Good day, class. Today we will discuss your laboratory diagnosis for fungal infection. The topic is divided into 3 short video lectures covering your selection of appropriate clinical sample. Second is microscopic analysis, and third will be your culture media. So in this video lecture class, I will discuss and present to you the different clinical samples that we receive in mycology. So diagnosis of fungal infection depends entirely on selection, collection, transport, and processing of clinical specimens. So we need to memorize these following parameters, class. We have selection, collection, transport, and processing. So anong ibig sabihin ng selection, class? Selection in terms of appropriate clinical sample. So pagdating sa mycology, class, yung kagandahan lang niya dito is that etiologic agent or fungi are classified based on their site of infections. For example, superficial mycosis, superficial infection. So, ibig sabihin ng class, these are the fungi that will cause skin infection. Other example class, systemic mycosis. These are fungi that can actually cause systemic infection. So, that will include other samples like CSF and then blood. Ayan. So, for example, you have ringworm and athlete foot. So, these are clinical manifestation caused by your superficial mycosis. So, pag dito pa class, anong kailangan na sample na i-collect mo? Magko-collect ka ba ng blood? Tama, class, hindi. Bakit? Kasi ang clinical manifestation niya ay skin infection. So, ano yung appropriate collection mo? Tama, class. Either magsaswab ka or magsiscrape. But in this case, class, better na magsiscrape ka or skin scraping. Yun. So, I hope na you understand the selection of appropriate clinical specimen or collection. For collection naman, class, ayan, for collection, so, dito, mahirap konti yung collection kasi hindi naman tayo talaga trained na how to collect the sample pagdating sa mycology. Majority of the sample is collected by physician. Pero meron lang tayong mga very common na nagko-collect lang tayo ng sample, class. For example, skin scraping or swab. Yun. So, dapat alam natin. Or collection of blood, kung blood yung sample. Pag CSF naman, class, di naman tayo allowed to collect and then we will call the assistance for physician. Yun. So, that's for the collection. Sa transport and processing naman, class, we'll discuss this one pagdating na sa culture and microscopic examination. So the first clinical sample, class, that we will discuss is respiratory tract secretion. Under this one is sputum, induced sputum, BW stand for bronchial wash or washing, BAL your bronchial alveolar lavage, and tracheal aspiration. According to Baylis and Scott, class, and other reference book, respiratory tract secretion is one of the most common clinical sample that we receive in microbiology laboratory for fungal identification. So we have processing consideration, class. First, specimen may be stored at room temperature if processing is completed within 2 hours. Sir, so anong ibig sabihin nito? So for example, you have 5 samples of sputum, class. And you think na these 5 samples, you can process it within 2 hours. So for example, nagpa-process ka ng 1 sample, the other 4, you can store that one at room temperature. Kasi alam mong within 2 hours, mapaprocess mo siya. So sir, what if I have 50 samples and then I can only process 10 samples for 2 hours. So, anong gagawin ko, sir, for the remaining 40 samples? Should I still store that one at room temperature? Tama, class, hindi. Saan mo siya i-store? Pag delayed daw, class, pag delayed ang processing, the specimen should be refrigerated at 4 degrees Celsius. Okay, tandaan, class, 4 degrees Celsius pag delayed yung processing. So, take note with this one, class, ha, kasi as a medical technologies, if you will process your sample beyond 2 hours, the integrity of your sample will be compromised. So, anong ibig sabihin ng compromise? Mako-compromise yung sample. Ang ibig sabihin ng class, that the sample, okay, either the sample contains bacteria and the bacteria will, what class? Try to multiply. And this contaminant class can actually hinder the replication of your fungi. Kaya pag nag-culture ka, what will happen? Pag nag-culture ka class, it will cause a negative result. So kung magre-report ka ng negative result sa doktor, anong gagawin ng doktor? Siyempre maniniwala sa'yo kasi ikaw ang medical technologist. Tapos hindi siya magbibigay ng gamot. Tapos hindi siya magbibigay ng gamot sa pasyente, what will happen to the patient? So the patient will die. So sino may kasalanan? Medical technologies in class. Kaya importante din yung trabaho natin. Okay? So you need to evaluate your capability kung ano lang yung kaya mo within 2 hours. Yan. So yun nga class, ito yung nabanggit ko na kanina that the most common specimen collected for culture is your respiratory tract secretions. Okay, take note class that respiratory tract secretions, specifically in the upper respiratory tract, contains what class? Tama, contains normal flora. And normal flora are bacteria that normally reside on your upper respiratory tract that will try to contaminate your sample. Kasi kung sa bacteriology, ang contaminant natin fungi, sa mycology naman ang contaminant natin bacteria. So yun class, so how can we control the normal flora? So we can use and add antibiotics to your culture media. And then, one problem din class pagdating sa respiratory tract secretions is that the fungi is too concentrated. So what will happen class? Pag masyadong overgrowth yung molds, we also have a problem identifying that one. We will just try to discuss that one pagdating sa culture. But for now, in order for us to prevent overgrowth of molds, we can use your cyclohexamide, okay, with a concentration of 0.5 ml. Paki-take note na lang class, paki-highlight yung concentration. Okay, pag tinanong sa exam, okay, kung ano yung ginagamit natin pang prevent the overgrowth ng molds, okay, huwag kakalimutan, cyclohexamide. Anong concentration class? 0.5. Okay, pag tinanong din sa exam, bakit nag-a-add tayo ng antibiotics sa culture media? Kasi class, yung usual lang ginagamit natin ng mga culture or sample, sorry class, mga sample, are those sample that are not sterile, specifically with your respiratory tract. Kung lower respiratory tract class, wala tayong problema. Kasi sterile naman talaga siya, yung lungs. Pero the way that you will collect the sample, for example, sputum, syempre, dadaan siya sa upper respiratory tract mo. Kung dadaan siya dun, class, madadaanan din na yung mga normal flora. And then, that bacteria can actually hinder with identification. Kaya, ang gagawin natin, we need to add antibiotics. Para yung ma-isolate lang talaga natin, class, is fungi. I want also to emphasize with the picture class, kasi yung sample nakalagay lang sa tissue. So, the proper collection for your sputum and respiratory tract secretion should be a screw cap wide mouth bottle class. Ayan. So, either glass or plastic, okay siya. Basta wide mouth. Ayan. And then properly labeled. Alam nyo naman yan sa class. The next clinical sample that we will discuss class is your CSF or cerebrospinal fluid. With your CSF class, yung pinaka common talaga na ginagamit natin is to centrifuge. However, pagdating sa other countries, they usually use filter class. Okay, filtered through a 0.4 micrometer membrane filter attached to a syringe. So if you can observe class, ito yung syringe. Yan. Ito yung syringe, then you have your syringe filter. Okay, the syringe filter class, yung pores niya dito class is 0.4 micrometer. Okay, bakit? Kasi ang matatrap nito class is your fungi. So matatrap siya dito sa filter. Pag natrap siya sa filter, i-open mo tong filter class. Tapos pag open mo, ilalagay mo siya sa culture media, CM. Filter, remove, and place to culture media. According to Baylis and Scott class, pag ginamit mo filter, dapat everyday lalagay mo siya into different place of your culture media. And then, examine everyday or daily. Yan. Pero class, yun yung nabanggit ko kanina, yung pinaka-common talaga for the processing of your CSF is centrifuge. And then, ito class, pakitandaan, if less than 1 ml submitted, use centrifuge and 1 drop of aliquot placed on several areas of your culture media. Okay? And then, process promptly, dapat promptly class. And then, if not, store at room temperature or at 30 degrees Celsius. And then, should not contain antibacterial or antifungal agent class. Bakit class? Importante to class. Kasi sa CSF class, CSF is considered sterile. So, if sa culture media tutubo yung bacteria, it means that other than fungal infection, possible that the meningitis is caused by your bacteria. Kaya, dapat i-consider din natin na other than fungal, merong bacteria. Ayan. Compare kanina class, yung respiratory tract samples, yung concern talaga natin is fungi. And then your upper respiratory tract, yung sinabi ko na kanina, contains normal flora, kaya dapat ma-minimize natin siya. But samples that are considered sterile, pwede na tayong hindi mag-add ng antibacterial class. Kasi pwede nang double yung identification. Kasi pag mga stellar area, pag sinabing sterile, like for example, blood and CSF, ibig sabihin nun class, dapat wala talagang organism. Okay class, pakitandaan na lang din, CSF specimen should never be refrigerated. So our next clinical sample class is blood. And what we usually do in microbiology class is that the sample blood, we use this one, diba, Bactec. And then we can actually identify this one using your blood culture system pagdating ng fungi. However, class, according to Baylis and Scott, for heavy incidence of dimorphic fungi, it is recommended to use your lysis centrifugation system. Your lysis centrifugation system, class, is still a blood culture system. Pero, sir, bakit kailangan natin gumamit ng lysis centrifugation system? Kasi, class, this system is effective in isolation of your histoplasma capsulatum. Okay, paki-highlight na rin din, class, that your histoplasma capsulatum optimum recovery is 10 to 14 days. So, ano ibig sabihin nito, class? Na kung magkukulture ka using your blood, dapat you will extend your culture up to 14 days. Kasi yung H capsulatum optimum recovery is 10 to 14 days. Pero class, according to Mahon, okay, and also supported with Baylis and Scott, okay, the reporting should be done after 21 days. Okay, although 14 days yung optimum recovery ng H capsulatum, pero yung reporting should be 21 days para sure talaga. Then the temperature should be 30 degrees Celsius class. Why? Because H capsulatum is a dimorphic fungi. It means, class, that they can transform to yeast form at 30 to 37 degrees Celsius. Ayun. So the optimal temperature for fungal blood culture, class, is 30 degrees Celsius, yung nabanggit ko kanina, and then suggested incubation time is 21 days. Ayan, hinighlight ko lang to, class, kasi for sure lalabas to sa exam. Next, class, is you have your urine. For urine sample, it should be processed immediately after collection. Okay? Tapos, class, paki-take note, paki-highlight na lang din, class, that unacceptable ang 24-hour urine. Ayan. So, pag may physician, pag sinabing pa-culture ako nito for fungi kasi may possible na candida ang pasyente. Tapos sinabi mo, anong sample to, sir? Ano ba to? Freshly collected sample. Tapos sabi na, 24-hour sample. O, diba? At least pwede mong i-educate yung physician, doc, kasi hindi pwede, unacceptable ang 24-hour sample collection. Ayan, class. Then, centrifuge and sediment cultured using loop. So, pwede mong i-centrifuge yung urine, tapos yung sediment yung kinokollect natin, class, hindi yung supernatant. Bakit? Tama, class, because your fungi are heavy and large. So, ibig sabihin, class, pag nag-spin down kayo sa your centrifuge, hindi tawag nito, class, hindi magpo-float yung fungi, kundi masasali siya sa sediment. Kaya ito yung sabi ni Bailey and Scott, class, na dapat pag nag-centrifuge ka, ang gagamitin mo is ang sediment. Okay? Ang sediment, class, hindi ang supernatant. Okay? Pakitandaan, class, pag mag-centrifuge ka, anong gagamitin mo? Tama, sediment, class. Next, class, is your hair, skin, nail, and scraping. So, obtained by scraping the skin with scalpel or microscope slide. Ang usual na ginagamit natin sa laboratory class is microscope slide, pero the microscope slide should be autoclave. Yan. And then, kung may scalpel, better class scalpel. Pero in my experience, kasi during our master's class, kasi I took my master's in UP, and then karugtong doon is si PGH. So, we also receive clinical samples for mycology. And then, usually talaga na ginagamit namin is sterilized microscope slide. Ayan. So, my MS class is public health in microbiology, medical microbiology, and then meron kaming subject na mycology, lecture, and lab. Ayan. And then, class, for hair, okay, you can use forceps. Tapos tatanggalin mo siya, class. Ayun. And then, temperature, 30 degrees Celsius for 21 days before reporting negative. And then, paki-highlight na lang nito, class, mycocell agar with chloramphenicol and cyclohexamide. Ayan. Dito natin siya kinukulture pag ang sample mo hair, skin, and nail scraping. Diba, ang ganda ng nails, class? Ayan. So, wag naman din natin paabutin na maganyan na yung nails natin, class. Kasi pag may ganyan, it means that the patient or you is suffering from a fungal infection. So, our last clinical sample, class, is eyes. So, either via corneal scraping or vitreous humor. Pag corneal scraping naman, class, collected by a physician. And it should be placed directly into microscope slides and inoculated into non-inhibitory media. So, pag ang physician naman, class, is medtech, yung background, so at least alam niyo na. So, if the physician is not, hindi medtech yung background, then, kit tayo, medical technologies, then we can actually explain the procedure. For the vitreous humor naman, class, for the vitreous humor, ang ginagawa naman nito, class, ang nagko-collect talaga physician. Bakit? Kasi yung syringe, ini-inject dito na part, tapos kino-collect yung vitreous humor. Ayan. So, very, mahirap. And then, yung vitreous humor naman, class, yun yung sinasabit na natin sa laboratory. So, that's it, class, for our clinical samples. So, I hope that you will memorize this one because for sure, this topic will be part of your exam and then for your quiz also. So if you have some questions, you can directly beat me up through Facebook or through our group or any social media that you want para ma-clarify. Okay, so if you have some questions, then don't hesitate to call my attention. And thank you for listening, class. And then if you understand this video lecture, then you can proceed to the next step, which is microscopic analysis.